Let's talk about what happens if the NHS is actually privatised and we move to an insurance-based system, because I don't think people realise how dangerous it would be. I'll preface this by saying I've dealt with private healthcare in the UK with insurance, private healthcare in America with insurance, and the NHS, and I will say the NHS always comes out on top. What people don't realise with insurance is it will be based on your pre-existing conditions or anything that you're at risk of. So if you have endometriosis, if you have a pre-existing condition that the NHS has already diagnosed you with, your insurance will cost an arm and a leg. And I know people will say, well, we already pay national insurance every month. It's kind of like insurance for healthcare. If you are high risk, you have to double, probably triple, quadruple that amount every month. And even then, your medication, your scans, your treatment may not be covered. I was in America and I had the best insurance, and I had scratched my eye with my contact, and I went to the A&E department, and not only did they not cover my visit, but when I had to pick up my prescription, instead of like the UK, a subsidised amount that's fair for everybody, £9.90 or whatever it was £90 for eye drops. A small bottle of eye drops, £90, that was covered with the best travel insurance I had. But not only that, if you cannot afford insurance, if you lose your job, if you cannot pay your mortgage and your health insurance every month, be prepared to get very sick or go bankrupt. And you can forget wanting to call an ambulance, because no one in their right mind is going to pay £2,000 to get to the hospital unless you are absolutely desperate. And you'll probably be stumped with a huge bill when you have children also. Depending on whether you have a cesarean or complications or additional medicine, you are looking at thousands of pounds. Even with private medical insurance in the UK, the anxiety of, first of all, you have to pay the excess before you even get seen by a doctor. That's like £100, £150, however much your excess is on your policy. But then also you don't know what's going to be covered. So you have to consistently ask. It's this anxiety thing of, I can't do this, I can do this. It is exhausting and anxiety provoking and scary. We are so incredibly blessed to have the NHS. We're so incredibly blessed to have ambulances for free, A&E for free, a GP for free. We are so incredibly blessed. And no, it is not perfect. You might have longer waiting lists, or, it might be a little bit frustrating at times, but it's free. It doesn't discriminate whether you are rich or poor, what background you're from. You have access to healthcare, which is a fundamental human right. The concept of privatizing that, of losing that, of moving to an insurance-based system is frightening as hell. And there are certain political parties and political figures that are trying to move to this insurance-based system, and I can tell you it will be the worst thing to ever happen to the UK. Any political party that is trying to take away free healthcare as a fundamental human right is a red flag.